The large intestine, also known as the large bowel, is a critical part of the gastrointestinal tract in humans, involved in the final stages of digestion, particularly in the absorption of water, electrolytes, and the formation and excretion of feces. It spans roughly 1.5 meters 5 feet in length and is wider in diameter than the small intestine, hence the name large intestine. It consists of several distinct anatomical regions: the cecum, colon, rectum, and anal canal. The colon is the largest portion of the large intestine and can be further divided into four major regions: the ascending colon, transverse colon, descending colon, and sigmoid colon. These segments are responsible for absorbing water, electrolytes, and vitamins, particularly vitamin K and certain B vitamins produced by gut bacteria. Ascending colon, located on the right side of the abdominal cavity, the ascending colon extends upwards from the cecum to the hepatic flexure, where it makes a right angle bend toward the left. The ascending colon is responsible for moving material upward and further absorbing water and salts. Transverse colon, extending across the abdomen, the transverse colon runs from the hepatic flexure right colic flexure near the liver to the splenic flexure left colic flexure near the spleen. The transverse colon is the longest and most mobile section of the colon, attached to the posterior abdominal wall by a fold of tissue called the transverse mesocolon. It plays a role in the continued absorption of water and electrolytes. Descending colon. The descending colon travels downward on the left side of the abdomen from the splenic flexure to the start of the sigmoid colon. It serves as a storage area for fecal matter that will eventually be moved into the rectum. Like the ascending colon, it absorbs water and electrolytes. Sigmoid colon. The sigmoid colon is the S-shaped final portion of the colon that connects the descending colon to the rectum. This segment is named for its shape, which resembles the Greek letter sigma sigma. The sigmoid colon serves as a storage area for feces before they are expelled from the body and is particularly prone to diverticula, small pouches that can form in the intestinal wall. Rectum. The rectum is the last section of the large intestine, approximately 12 centimeters (4.7 inches) long, and is located in the pelvic cavity. It extends from the end of the sigmoid colon to the anal canal. The rectum serves as a temporary storage area for fecal matter. Specialized stretch receptors within the rectal walls send signals to the brain when it is time to initiate defecation. Anal canal. The anal canal is the terminal part of the large intestine, about 2 to 4 centimeters in length, and leads to the anus, which is the external opening of the gastrointestinal tract. The anal canal is surrounded by two sets of muscles: internal anal sphincter, an involuntary muscle controlled by the autonomic nervous system; external anal sphincter, a voluntary muscle under conscious control, allowing for the regulation of defecation. Blood supply and innervation. The large intestine's blood supply is primarily from branches of the superior and inferior mesenteric arteries. Venous blood from the large intestine drains into the portal venous system, ultimately flowing into the liver for further filtration. Nerve supply to the large intestine is regulated by both the autonomic parasympathetic and sympathetic and enteric nervous systems, coordinating peristalsis and other muscular contractions involved in the movement of fecal material. Functions of the large intestine. Beyond its structural components, the large intestine performs several essential functions: water and electrolyte absorption. It absorbs the remaining water and electrolytes from indigestible food matter, contributing to the formation of solid stool. Formation and storage of feces. As waste moves through the colon, it becomes progressively more solid, forming feces that are stored in the rectum until defecation. Microbial fermentation. The large intestine hosts a diverse microbiota that ferments indigestible carbohydrates, producing gases,